poll issued today, it was done by The Guardian, I think, showed that half of British public lack confidence that family or friends would be looked after. And apparently 9 out of 10 older people say that there are not enough staff in care homes. 1 in 10 care worker posts, should I say, currently vacant. And lots of us think that care workers are indeed underpaid, 2/3 of us, I think. You don't mind me saying, I asked you this earlier on, your mum is in a care home.
That's why I can't afford to give her any reparations, I tell you.
No, you can't go back. You can't go back on it now. We've struck a deal. It's on national television, sorted. Dominique is in the money.
Yep.
So tell me.
So my mum's in a care home. She's 92, she's blind and she's got Alzheimer's. My dad died last year, and up until about a year ago, they were both, well, before he died, obviously, they were both at home and we had a live-in carer. Now, that's fine if you've got the space and you can afford it. But my mum got to the point where she needed more nursing care, so we had to make the decision to put her into residential care. And I tell you, and I'm sure there are many, many people watching and listening, it is a minefield. For a start, there's a whole difference between what funding you can access depending on what illness or disease you've got, whether you need nursing care or whether you need residential care. Now, we are in a very fortunate position that we can pay for my mother's care. It is horrendous, Michelle. The cost is unbelievable. And I know, and it is a lovely care home. It's a fabulous care home. It's like a, super 5-star hotel. The staff are amazing. Those staff are getting paid pennies.
This is what gets me, because it's eye-watering costs, but then it's not going to the staff.
No, it isn't, and it's going to the owners of the care homes who are making absolute packets, and they've got an absolute guaranteed market because we're all going to get old and we're all going to need care.
That's wrong.
It's absolutely wrong.
And then what are you saying then? That you shouldn't have any private sector care homes?
No, I'm not saying that at all, but I think, it is a real crisis, and the difference between a good care home and a bad care home isn't just down to, well, a lot of it is down to the staff and the on-site management, but a lot of it is down to the space, the number of residents they've got, the quality of the building, the quality of the food, and all of those sort of things. And because we've got this absolute conundrum between social care and health care that no government of any colour, political colour, has ever dealt with properly, despite endless promises over the years, this is a problem that's only going to get worse. And I know, I'm sure there are people watching, and we said it, we'll never put you in a care home. But
I would like to think I wouldn't, but
that actually you cannot manage at home when somebody needs full-time nursing care, they can't get up, they're doubly incontinent, and you physically can't do it because it needs 2 people. And
it's very challenging.
It's really hard.
I'm glad you offered that perspective, because I would like to think that I wouldn't, but actually putting it into perspective like that, put my mum in a care home, but putting it into perspective like that, I do understand why people do that. I presented a documentary not long ago about a man named Tony Stoll, and he's actually suing his late mother's care home for reasons to do with her care, and it really made me frightful of maybe one day putting my mum in such a vulnerable situation, especially when, a lot of these the staff that work at these care homes, that they're overworked, they're underpaid. And I think what we forget is how vulnerable these elderly people actually are. They're relying on people to bathe them, to take them to the toilet. And when you actually overwork people and underpay them, in my opinion, you limit their capacity for empathy, and I think that is how you leave elderly people vulnerable to abuse. And when you have a job that's, the bottom 10% of the worst paying jobs in the UK, you can attract wrong-uns, actually, that don't care about the pay but actually just want the power trip. Look, I think that's what people forget.
I'll throw it out to you at home. Why do you think that we value carers so little when it comes to the wage that we pay these carers? Do you think it is just as simple as, private care home agreed? Maybe you own a private care home. What do you think to it? Do you pay your staff more than the minimum wage? And if not, why not? I'm fascinated to hear your view. And by the way, would you pay more tax, actually, to fund social care in this country if it was a ring-fenced amount of money? I don't know, say 5% extra tax, whatever. Would you pay it? Would you be comfortable in doing so? Your thoughts, please, gbviews@gbnews.uk. When I come back, I'll have some of your